Signs and symptoms of breast cancer and what to do. Breast cancer is the most common cancer affecting millions of women worldwide. It is a disease characterized by uncontrolled and abnormal growth of the breast cells. These cells are not as mature as healthy cells but grow much faster than them. As a result, they form lumps or masses in your breast tissue. The cancer cells from the breast may spread to lymph nodes or other parts of the body. This cancer can occur in different regions of your breast, causing multiple signs and symptoms. Breast cancer causes lump formation or thickening of breast tissue in certain areas. You may be able to feel the difference in breast texture by examining your breasts. These lumps are cancerous growths that make your cells divide rapidly. Such cells are not mature and function abnormally. When the cancerous lumps and tumors press against other cells and healthy tissues, they cause damage, and as a result, you experience pain in your breasts. This pain may accompany a burning sensation in some cases. However, pain is more common in the later stages of cancer. The overproduction of poorly matured cells that do not function properly can give your breasts an uneven appearance. If cancer has affected one side of the breast, it may appear larger and more irregular than the other part. Red and swollen breasts are a hallmark of inflammatory breast cancer. If you have breast cancer, parts or your entire breast may appear red, enlarged, and warm to touch. As the cancer cells spread, they damage the surrounding structures, cells, and tissues. These damaged cells release chemicals like histamine and prostaglandins. The released chemicals increase the blood flow to the area, causing redness, swelling, and inflammation. Many people experience painful and swollen lymph nodes. When breast cancer starts to spread, the first areas it affects include the lymph nodes under the arm and those near the collarbone. Cancer usually reaches the lymph nodes in stage 3. Changes in the breast skin are the most prominent sign of breast cancer. These skin changes may vary. Orange peel-like skin texture with pitting may be a sign of inflammatory breast cancer. Other changes like discoloration, puckering, peeling, and rashes on your breast skin also indicate the presence of cancer. Breast cancer may also lead to changes in the appearance of the nipples. These changes can result in nipple inverting, scaling, or thickening. The nipples may also appear inflamed and be painful. The circular pigmented area around the nipple, known as the areola, can also change its appearance in breast cancer. It may appear discolored and its boundaries become uneven. Nipple discharge is also a common sign of breast cancer. It usually occurs as an early sign of carcinoma in the milk ducts. The nipple discharge may be clear, milky, yellow, or brown. Some people may also have a bloody discharge. Additionally, the consistency of the discharge also varies. Having a fever along with other symptoms also indicates cancer. Cancer suppresses and weakens the immune system of your body and makes it prone to infections. As a result, you can catch a fever. Another cause of fever is that the tumor cells or cancerous growths release pyrogens, signaling your body to raise its temperature. People with breast cancer often report persistent fatigue and tiredness. The cancer cells damage other parts of your body. It has to work harder to repair these cells and provide energy to the extra poorly matured cells. As a result, you feel exhausted. Doctors generally perform multiple tests to diagnose breast cancer. These tests include a mammogram, ultrasound, MRI, and biopsy. A mammogram is an X-ray imaging test of the breast. The presence of white, high-density tissues on the mammogram indicates breast cancer. If there's a lump, its shape, sides, and edges are measured. Ultrasounds are usually used to differentiate if the structures identified on the mammogram are fluid-filled cysts or cancerous tumors. Breast cancer masses generally appear slightly darker than the surrounding tissues in ultrasound tests. MRIs are used in combination with mammograms and ultrasound and confirm the presence of breast cancer. Afterward, your doctor may perform a biopsy. A breast biopsy is an uncomplicated procedure in which a sample of your breast tissue is taken to determine the presence and type of cancer. The treatment of breast cancer usually involves surgery, radiotherapy, and chemotherapy. The stage and type of cancer determine whether you get one or a combination of these treatments. If breast cancer is detected early, it may increase the chances of recovery. Therefore, doctors advise self-examination once a month to notice any changes in your breast's usual structure. Breast self-examination involves looking out for appearances and structural changes in the breast by sitting in front of the mirror. You must note any changes in structure or skin color. Besides appearance, it is also essential to check the breast and the surrounding areas for any lumps or painful nodes using your fingers. 3 fingers, including the index, middle, and ring fingers, are used for this procedure. Breast self-examination should be performed around 10 days after your menstrual cycle ends to rule out any cycle-related changes. Fighting cancer can be challenging and tiring. If approved by your doctor, some complementary therapies may be helpful in the recovery process. These include gentle exercises like walking, yoga, or Tai Chi. Stress coping strategies and meditation can also be useful. A breast cancer diagnosis is often overwhelming. It is essential to communicate with your family and friends. Additionally, you can find support from psychological services to cope with the shock and make better decisions for your treatments. People with severe illness may opt for palliative care. This kind of care is an approach that does not focus only on the disease. It helps people stay on track with their health goals and provides support both emotionally and medically. A healthy individual can reduce the risk for breast cancer by maintaining a healthy lifestyle, keeping weight in check, and following a balanced diet.